Not that long ago, on a Friday segment of the show, when we were asking you what you wanted to talk about, a couple of people called up and specifically talked about what we're going to talk about now, which is Canada's dental plan, and how things within the plan are not what necessarily they appear. They were in it, they were out of it, can't get back in it. There have been gaps. There's an article in the Globe which basically has the headline that says it all, which is Canada's public dental care plan is rotten at the roots. Thought we'd try to find out more and maybe shed some light on what really should be happening and hasn't. Dr. Brandon Doucet is a Nova Scotia-based dentist and founder of Coalition for Dentalcare and is on the line. Dr. Doucet, thanks for being here.
Thanks for having me.
Let me begin by asking, what seemed like a great idea when it was beginning to be implemented. Is it fair to say it's not turned out quite the way we would have expected?
Yeah, so I would say this is definitely a step in the right direction, but I don't think it's living up to the full promises that what we were promised in the lead up to this program. For example, we were told between 8.5 to 9 million people would be eligible for this program, yet last year only 6.5 million people signed up for this program. And I think this has something to say about, the burden it is to actually apply for the program. There's a lot of people who thought that they would be eligible as well and then didn't. For example, a lot of seniors who dropped their work-related coverage when they retired because it coincided with a large increase that they would have to pay for it while a drop in coverage. So a lot of seniors decided, I'd rather join this government program only to find out that they weren't eligible for the program despite originally it seeming like they would be.
The other part of this, and I think back to the calls we took, if I'm not mistaken, the idea was, or the question was, look, I was in the program, then I ended up with private dental care through my job, and now by virtue of that, I can no longer be in the program, or I lost that job and tried to get back in, and I can't get back in. So have you come across cases like that? You mentioned private dental care. What happens when you're in that and decide to get out of it to be able to get into the dental care plan?
So basically the way it works is it goes based on your tax return, and there's a new element in our tax returns asking if we have work-related dental insurance or private dental insurance that we've bought individually. And this data is used to determine your eligibility for the Canadian Dental Care Plan. So basically, originally it says if you don't have private dental insurance, you would be eligible for this program. But they ended up changing the wording to if you have access to private dental insurance. Uh-huh. And this is a much more fickle thing because what does having access to private dental insurance really mean? Like technically everyone would have access to it, but that's not obviously what it's meant. But it's basically implying people who, like I said, seniors who, dropped their coverage when they retired, would not be eligible for this program, rather forcing them to pay for this plan that also coincides with a drop in coverage and increase in costs when you retire. So you're forcing these seniors who are already, struggling to get by to pay for private insurance to help protect the private insurance industry rather than looking out for those regular people.
Yeah, it does seem to punish people for the wrong reasons, doesn't it? I mean, you want to do the right thing. You want to, if you had that access to private dental care, that shouldn't affect whether you can get into this plan or not.
Totally, 100%. And I think another big disappointment that we at the Coalition for Dental Care were disappointed with, people were also promised no co-payments if they made less than $70,000 per year. But the Liberals actually decided to allow what's called balance billing, which is basically the difference between the CDCP fee guide and the provincial dental fee guides, or whatever the dental fees the dentist charge, because they can charge above the fee guide. So basically what this balance billing has done is created a 15% co-payment for that cohort that was originally promised no co-payments at all. And then those other groups between 70 to 90,000 who were told they would have co-payments are having even bigger co-payments than they were told. So, over 50%. So you can imagine if you have over a 50% co-pay, it's going to be hard to use that coverage.
And again, that's money out of pocket as well that many of the people presumably couldn't afford, which is why they probably were excited about this dental plan to begin with, only to discover, of course, it's not exactly what it is, I guess, laid out to be. I guess my next question is, with respect to what it does cover, do you think people had the wrong impression that simply if you were on the plan, you could show up at a dentist, whatever the problem was, would get taken care of, and not just cleanings or fillings or x-rays? How does that work? And do you think people had the wrong idea?
So I'm sure some people may have got the wrong impression, but I do think that a lot of people are having a good experience with this program if you just need run-of-the-mill regular dental care. So basically what I mean by that, you need to go in for a cleaning, you need a filling, you need what's considered basic care. There's no predetermination for that. Basically, it functions like any private insurance where you don't have to do paperwork beforehand or anything like that. There has been some issues with more comprehensive care and having some difficulties getting more complex care approved. Now, that being said, there still is quite a few that are being approved, and that's care that wasn't being covered at all just a couple of years ago. So, we're still making steps in the right direction, but I think the problem with this plan is that it doesn't go far enough.
Do you think, based on, what we've seen and what you've described here in the coalition, that there will be changes? I mean, is the government listening to this? Do they understand that it's not as good as it should be? Do you have that sense?
No. No. I think it's worthwhile noting that the Liberal government originally voted against this dental care plan when it was originally proposed by the NDP 3 different times in the last parliament before being forced in the supply and confidence agreement. So this is something that I don't think the Liberals would budge on unless they're forced to.
Okay. I'm not sure if it's fair to ask you if you had any suggestions for those people who had called my show and said, wait a sec, I used to be on the plan, then I try to get back in, now I have to wait. There's no getting around that, right? I mean, if that gap is there, you literally have to wait. There's nothing you can do.
So if you miss the renewal date, so the renewal date is less burdensome than the reapplication date. And so if you apply, if you submit your renewal before that date, you will have no gap in coverage.
Okay.
But if you miss that renewal date, which I believe that a couple million people have, you can reapply, but you have to go through that whole process
all over again, right.
And there will be a gap in coverage.
And that gap, do you have any idea how long that gap is? Is it weeks? Is it months?
It's hard to tell. I do think when we originally saw the program roll out, it took longer to approve applicants because millions of people were applying because it's a new thing that no one's, it's a new program. There was no one on it. So I'm wondering with the renewal process, since a lot of people did go through the renewal, if you have to reapply or you're applying new, I'm hoping there isn't, tens or hundreds of thousands of them in the backlog. So hopefully they can get through them a little quicker. But I imagine it being at least a month.
All right. I very much appreciate your time, Dr. Doucet. Thanks so much.
Thanks for having me.
There you go. That's the story in the Canada Den. It's what we would call imperfect. I think that the most telling number, 9 million Canadians eligible, and 6.5 million have actually managed to get through this and sign up and actually be able to use it. That's 2.5 million people roughly still have not figured out how to get into this plan, which is kind of crazy.
iHeartRadio is throwing it back.
2010s, the decade.
To the days of huge hits and unforgettable anthems. A non-stop stream of the biggest and best.
Drake, Rihanna, Beyonce, Katy, Gaga, The Weeknd,
and more. All your decade-defining favorites, all in one place.
Hi, it's Katy Perry.
Hey, it's Bruno Mars.
This is Kesha.
Find 2010's The Decade on the free iHeartRadio app. Preset the station so it's always one tap away.